So, and then this next section is really gets into some subtleties, but they are fun. The first is looking at complementary patterns, which, as I say in many of my workshops, I am someday going to write a book on complementary patterns from Freud all the way to postmodernism and every theory in between, because this is really where the uniqueness of each theoretical approach and where a lot of the jargon and everything, but complementary patterns are looking at how two opposite either internal dynamics or relational dynamics intersect. So you have the pursuer and the distancer, right? You have logical and emotional. It's these opposites, and when these get polarized, whether it's within us internally, psychologically, or relationally within a couple or family system, when these get polarized and rigid, you almost always have problems. Okay, whether it's individual, couple, or family, complementary patterns are at the heart of conceptualization in most approaches to counseling and psychotherapy. So along those lines, so satir survival stances, which is when you are congruent, a placater, meaning you are a people pleaser to avoid conflict. You're a blamer. You're the one who kind of sees everyone else being the problem. Super reasonable, where you just want to get super logical and forget about emotions everywhere. Or irrelevant, you just don't want to deal with emotions. Your emotions, anyone's emotions. Let's just keep it fun and mixed up and keep it moving, right? So knowing those communication stances can be really helpful in conceptualizing what's going on in a system or a relationship, or even at an individual level. And then I also have here, if you're working with a couple, to kind of run through Gottman's predictors of divorce. It can give you some good ideas about where to start when working with a couple. So let's look at this. So you'll see some of these complementary patterns. So the pursuer distancer is a real classic one. You also have the overfunctioner and the underfunctioner. So it's the parent or the person in the relationship who's doing most the work, and the other one who's like always struggling with something. Highly emotional, highly logical, the good versus the bad parent. But there are lots of other, complementary patterns you might see with your clients. You can see here, what are the communication stances? And so when they are in an argument, what do? Most people, just for the record, are not congruent during an argument. They normally placate or bang. Under enough stress, all of us will use one of these stances. It's good to know what they are. And you can see for couples, you can use Gottman's divorce indicators of criticism, defensiveness, contempt, stonewalling, which means shutting someone out, either just not responding or minimally responding or literally leaving the room. Failed repair attempts, meaning, someone tries to have a truce and reconcile, and the other person does not accept it. Men not accepting influence from their partner. And then harsh startup is when you kind of go into an argument. Instead of doing it gently, like I noticed the other day, you're like, I can't believe you, da, da, da. So harsh is when you don't start your criticism of your partner gently or respectfully. It starts heated, usually because there've been a lot. This has happened more than once before, so you're just already revved up. So got a question here about who defines good versus bad parent. Usually the kids. I mean, usually the kids will say, this is the nice parent who's going to let you get away with everything, and this is the, disciplinarian. So the good versus bad is all subjective. I mean, that's definitely a subjective one. And sometimes the couple within the couple, they'll feel like I have to be the disciplinarian and my partner won't do it. So that's what we mean by good versus bad. Usually it's the fun one versus the disciplinarian. And that is not a helpful dynamic, as common as it can be, and it certainly is the common family structure from the 50s, 60s, 70s. That's a very common structure, but it is not ideal to have that polarity. Okay. So we're coming up to the hardest two parts of the assessment: the interactional patterns and the hypothesis, the systemic hypothesis. So the hallmark of family therapy is looking at this interaction pattern. So person A does something, person B responds, and person, there can be C, D, and E in here, but we're just going to do A and B to keep it simple. Then A responds to B, and B responds to A, and they have this pattern, this little dance that they do, right? That is the heart of systemic family therapy, and assessing that is really key. And normally you're looking at, what are things like when they're normal, calm, whatever you might call it? How does tension rise in the system? What do things look like at the worst? And then how do we get back to normal? And this is all around the symptom. Now, this actually does happen both intrapersonally, so internally in your mind with things like depression and anxiety, OCD all have these patterns, as well as interpersonally between people. It's so much easier to actually see between people. It's probably the only thing that's easier to assess in a couple and a family. So, and systemically, they're looking for what does the symptom in this family, what's the function it has in maintaining a sense of normalcy within the family. So, but this interactional pattern is what you need to assess. And then the systemic hypothesis is, looking at that pattern, right? What is your best hypothesis? What is your guess at the function that this symptom plays in the family? So for example, the classic hypothesis, if a child, let's say, is acting out or failing at school, a common hypothesis is, after assessing the dynamics, like let's say the parents aren't, argue a lot, but when the kids are having trouble at school, the parents pull together and parent together, and the couple, the tension between in the marriage, let's say, gets less when children act out. Children will unconsciously often end up acting out to stabilize the family system as a whole, because it's much better to be in trouble at school than to worry about whether or not your parents are going to get divorced. Usually none of this is conscious, it's more unconscious. Other forms of, conflict in a system can be about trying to get a sense of power and influence over one's life, can be actually avoiding too much intimacy as well. There's usually one person's more comfortable. I mean, like in a couple, each party usually has a different comfort level around how much intimacy they want and can tolerate, or how much the system was built around. And so that's why, if we have one partner who's pursuing, the other one distances, if you get the pursuer to stop, usually the distancer will turn around and start pursuing again, because there's just like a certain amount of closeness and distance that it's just comfortable. And it doesn't matter who's pursuing and who's distancing, they're going to keep that as same. So, so these are some of what we talk about this systemic hypothesis for, but you'd want to use client language and metaphors using positive connotation, right? So focusing on the desire to be close, or the desire to, like for a teenager, to individuate, and looking at themes of love and power within the system. And so you can see here, you can look at the pattern and you can describe usually there's a complementary dynamic in the pattern, like pursuing versus distancing, criticizing versus defending, controlling versus resisting. You keep filling that out. There are lots of different options that you can have. And then you want to describe the basic pattern, which is what's quote unquote normal, which just means minimal or no symptoms, right? How do things escalate, and what are things like at their worst? And then how do things get back to normal? That gives you the most intervention, in my experience, for what is going to be helpful for this individual, couple, or family in navigating. And then looking at the homeostatic function of the presenting issue. So how is a symptom, whether it's conflict or defiance, how is it maintaining connection, creating independence versus distance, establishing influence, reestablishing connection, or otherwise helping to create a sense of balance in the family? Even if it's not conscious, how could this symptom be maintaining the homeostatic norms? So, a lot of this helicopter parenting, right? These are parents who are wanting to ensure their children's success, right? And so, but it keeps them involved. It keeps a sense of connection. And but the kids could be rebelling against that. So you could have defiance in response to a parent's, is pursuing the child in that case. And if the kid's being defiant towards that, then the kid is rebelling against that, how the parent's trying to define closeness and distance in the relationship. So this is what the homeostatic function is of the presenting symptoms. And even things like depression, like having a depressed client or chronically ill, in some, maybe not chronically ill, but depression in some cases, not all, ends up, let's say you have a parent, and we do see this in family systems where, there's this kid who is depressed or adolescent or young adult who stays depressed, non-functional, and there's a parent who's very involved in kind of parenting this young adult. And the function of that may just be, and there are families where we see this, where the function of the under-functioning teenager or young adult is that the parent will not have a role or identity, or will, go into, is going to experience their own crisis if the child truly individuates, goes off and starts their own life, or that it's usually not conscious, it's very rarely conscious, but there's a pattern that you can see in families. Next, we look at intergenerational and attachment patterns. So there's a genogram with instructions on how to do a genogram. These are awesome. I have so many students who've resisted me over the years going, oh, they don't, I don't want to do a genogram. I don't need a genogram. But I force them to do at least one for my class. And then they say something like, come back going, oh my God, that was so useful. That was so helpful. I have never done a genogram or had a student do a genogram and not come back going, that was really useful information. So definitely something to consider. And then looking at attachment style, where generally you're looking at secure, anxious, avoidant, or a combination of anxious and avoidant. Okay. So here you can see this is right off of the form. So when you construct a family genogram, you want their names, ages, as best as you can with birth and death dates or years, relational patterns. So that's using, who's close, who's distant, who's cut off. Occupations are usually really useful if there are histories of psychiatric disorders, substance abuse, health issues, abuse histories. And I love to give 3 personality adjectives to the main characters that the client knows. And then, what did you find? So looking at histories of substance abuse, sexual, physical, emotional abuse, parent-child relationships, often those will just literally repeat from one generation to another. Physical or mental health disorders, history of the presenting problems. So if you've got parent-child conflict, ask about parent-child conflict in the various family systems across generations. You'll be surprised how often. And then family strengths, what are the strengths? This is a family that, has a lot of fun together. There's a lot of care. And then also looking at the attachment patterns. So, and again, I have variations of this form. I think I push you a little bit more on the theory-specific one. So the real question is, when there is conflict, right? Do they tend to be anxious? They are usually the pursuers. Do they tend to be avoidant? They're usually the withdrawers. Anxious avoidant folks start to pursue when their partner reaches out or their parent reaches out, they withdraw, right? And you get this crazy kind of figure 8. They both pursue and withdraw in the same moment of conflict. There are very few people who I will check the box for secure attachment, because the question is really, under threat, are you able to self-regulate is the question. And so if they're coming to therapy, they usually are going to have one of these anxious or anxious avoidant patterns. Anxious avoidant patterns really are associated with untreated trauma. So that's just something to be aware of. And I go over that quite a bit in my emotionally focused couples therapy lecture. Okay, solution-based assessment. So there are basically always 2 types of solutions, those that have worked, those that have not. So if you remember the early Family Therapy Mental Research Institute, MRI approach, they assessed, what solutions the family has tried that didn't work, and they did a 180 solution-focused therapy, started by Steve DeShazer, looked at, so let's just go straight to the solutions and forget, you don't even have to do that first step. So I have a lecture you can find on YouTube on solution focus. I have multiple, I guess. So generally, it is easy to assess failed previous solutions. Most clients are ready to tell you what they tried and didn't work. And that's good information to have. You can rule those sorts of things off, because typically doing more of that type of solution, like if they've done harsh punishment and it hasn't worked, yeah, usually you need to build secure attachment in those types of systems. So it's good to ask those questions. And then from a solution-oriented perspective, looking at times when there are exceptions, like there could have been a problem, the problem could have emerged or happened, but it didn't, like a time when a couple or family could have been, had a fight, but they didn't, for what's that all about? And so looking for those exceptions, looking for, maybe they fight about school, but they never fight about what to do on the weekend or sports, or they never fight when they're vacationing. I have a lot of couples who do not fight when they go on vacation, they fight at home only, right? So so looking at all of that. Okay. And then miracle question is classic way. So the miracle question actually is delivered in a very specific way to do it properly as a solution focused therapist. I think there's a tiny bit of like Eric, a little bit of hypnosis is too strong, but there's a very specific way to get the client into the right headspace to imagine that future. And so the proper way, I have in my solution focused therapy videos, I discuss it, but in a simpler way is like, yeah, if in 6 months or 3 months, all the problems you came to see me for have been resolved, what will you all be doing, right? What would be happening in a typical day? And describing what is happening, not what's not happening. So, okay. I do see a question about a genogram versus an eco map. A genogram is really for intergenerational family patterns. An eco map is much broader with the social system. So intergenerational patterns tend to affect us quite a bit. Eco maps kind of look at the broader social system. So genograms are very specific, and they are focused entirely pretty much usually on the family, and those repeating patterns that tend to happen from one generation to a next. Okay. So here is what this looks like on the form. So attempted solutions that did not work. Exceptions and unique outcomes. Unique outcomes is more the narrative therapy language. So what has worked? Time, places, relationship, context, when the problem is less of a problem, right? So sometimes, a child's defiance is less of a problem with one parent versus another, right? Or when both parents are home, it's a problem. When the child's with just one or the other parent, it's not a problem. I have seen that as well. So if it's one-on-one, they're fine. You put the two parents in a room with the kid, always a problem. So let's see. And then the miracle question, if you answer, so you want to be stating it in positive terms, what is going on? But yeah, if a problem were to be resolved overnight, what would the client be doing differently the next day? And so kind of asking this, you can do it in the future, you can do it the next day as a miracle. But there is an art to asking this question. And if your clients are coming up with a blank response, then you need to do more of the build up to help them imagine it. And you can use some multiple choice type of thing to kind of get the ball rolling, but always a valuable question as well to ask clients. Okay, so the last major section is the postmodern section, where we look at social location and dominant discourses. So this is looking at the layers of cultural context around the client and identifying how that is affecting their experience of self and their experience of the problem. So dominant discourses are discourses that are in society. So we can conceptualize a dominant one single one, but increasingly our societies have become, the internet has fragmented our dominant discourses. So normally we are affected by multiple. There are discourses around gender. There are discourses around age, generation, right? We got the whole generation war going on between boomers and Gen X and millennials and Gen Z, right? That's a discourse, right? That's an example of an age-related discourse. Obviously race, ethnicity, we've got, discourses, but even within, cultural groups, you may have folks who speak the cultural language and those who don't, those who are religiously observant, those who don't. So even within a community, there are sub-communities, there are multiple layers, right? And then there's the way your family interprets the religion or the family's cultural background and celebrate the holidays versus, your cousin, right? They can have very different ways. And even within a family, a larger extended family system, there can be huge variations in how all this is experienced. So what you're looking for is how these discourses affect a person's sense of identity. And And so exploring all of these. And so, and if affecting how they see themselves and how they see themselves and the potential in their lives, right? And how they see their problems. Because we also have a whole set of discourses around people who have problems like me. So in my Therapy That Works Unifying Framework, there are two levels. We look at the kind of dominant cultural narratives about your social location, but equally interesting are the discourses around people who have problems like you. For example, a couple going through a divorce, right? What does it mean to be divorced at this age in my life, right? Fill in the blank. What does it mean to have OCD or be diagnosed on the autism spectrum, right? They're all, and those narratives are fluid and change, constantly changing. So just being aware of this and how that is affecting your client. I once had he was young. He was, I don't know, 7, let's say, something around that, who had been given the diagnosis of ADHD. And I was trying to do a family session, trying to have him sit in his chair and working with his mom. And at a certain point, he just looked at me and he said, I have ADHD. I'm not supposed to sit in chairs for long periods of time. Like that was his job. So sometimes, especially with kids, these dominant discourses take the form of marching orders. And so understanding your client's understanding of whatever diagnosis they've been giving or whatever label their parent has given them, right? The social kid, the high achieving kid, the athletic kid, the non-athletic kid, whatever it is, right? All of those labels are very, very powerful. And I highly encourage you to figure out how to get a meaningful answer to all these, major areas when you're working with any of your clients. So like for this first one, race, class, ethnicity, immigration status, religious discourses, I've had clients say, I've had students say, well, they're nothing, they're none, if let's just say you have a couple and they're quote unquote white, but one comes from Northern European, let's say they're Irish background, the other comes from Southern Europe, Spanish, Italian, Greek. One is communal, one is individualistic. So those are very different cultures. Even if we collapse them under European white, they actually are going to have be coming with very different sets of cultural norms, expectations around boundaries, and how much closeness versus distance is comfortable. So this is really important. Immigration status, are they the first generation here? Or are they the third or fourth generation here? Huge difference, right? So they may have, let's say, come from Mexico to the United States, but did their parents immigrate or did their great grandparents immigrate? You're going to have very different identities and norms, right? And then looking at gender versus sexuality. And so everyone has some gender discourse that is affecting, in fact, how they interpret their class, ethnicity, race, right? Religious discourse is all interpreted, again, made two-dimensional by your gender identity, right? For example, in many religions, there are very different discourses around what a man versus a woman is and how all that fits together. So all of this is really important to be discussing, especially at a time in history where we are looking at, gender identity has become much more fluid. There are far fewer rigid role expectations around gender and sexuality. And so these are important things to put into language for your client. And even being a quote unquote traditional male or traditional female or cis male or cis female, what the heck does that mean to your client who's sitting in front of you? There's almost an infinite number of ways that that can be expressed. And so having those conversations with clients can be very, very powerful. And then exploring that within whatever the presenting issue is. Even what does it mean to be a depressed man versus teen boy versus a, depressed teen girl versus a depressed, middle-aged woman, right? So different discourses around all of those things. And what you want to ask and understand here is how your client is interpreting all of these. And then looking at community, school, work, and other societal discourses, and just how the client's presenting issues fit into whatever communities that they're most regularly a part of, right? For example, if you have someone who's a Hollywood actor versus an engineer, right? Just how their community talk and think about navigating life is really different. What is a school discourse like? What is a person's particular work environment like? What are their neighbors and friends saying, extended family saying about their problem, about who they are, on the planet. So understanding all of this is really important when you're working with children, adolescents. The school culture is critical, right? What social group they're a part of. I assess that every time. You're part of the popular kids, you're part of the jock group, you're part of the academic crowd, band, who are you? Theater troupe, who are you? So which group do you tend to hang out with? And what does all that mean to you? And how do you see yourself in that system is really huge. Yeah, and then the last one is problem related identity narrative. So how is having this problem affecting the client's identity? For example, there are a lot of couples who have tension in their relationship and they don't tell anyone, even their best friend or family members. So there's this alienation, right, that might be happening, or they feel less than, they feel like a fraud often if they're not sharing some of that. Or if a child has something like a diagnosis like ADHD or anxiety or OCD, how does that affect how they see themselves, in their life and compared to their peers, let's say, or their siblings? So understanding how all of that has affected your clients is really helpful and gives you a lot of ideas about how to be helpful. And these conversations themselves are extremely eye-opening and insightful for most clients and for us. And finally, the last section is client perspective is, depending on which theoretical approach you're using to, get the client's perspective on what to document that, what they think about what you think is going on. For example, if you think boundaries are either enmeshed or the hierarchy is too much or too little, when you presented that in one way or another to your client, did they give feedback? Were they, yeah, I know I really need to toughen up on my parenting. I'm very inconsistent. Or did they feel like what they were doing was correct, right? So being able to just, get the client feedback, pay attention to that, and navigate that skillfully is really important. And then just always remembering with case conceptualization that there is a lot of subjectivity here. This is why typically this does not go in a progress note. You can listen to my progress note lecture. It goes in what's called a psychotherapy note, at least here in the United States. The HIPAA law distinguishes between these two types of notes. So there's a bit of subjectivity here. And just always knowing that there are many layers of culture and family norms, right, that you want to be thinking about as you assess, is this boundary enmeshed? Is it clear or is it rigid? Even your ability to perceive that, you're looking through all of your lenses and your cultural norms. So whether you come from a communal culture of individualistic culture or have your own little mix thereof, right, you're going to have biases when you're looking at your clients. So just keeping aware that there's a lot of subjectivity and you getting your own lenses clear is really important. And so that is a real important part of case conceptualization is you being aware of your own lenses, biases, and being able to accurately assess what's going on in the various layers of context with the client. For example, most clinicians who have master's or doctoral degrees, right, they generally tend to be in a higher social class than many of their clients, right? Some of the most educated people in our society, quite frankly, in most cases. And so when if you're working with someone who has less education, which most of the time we are, most of the time our clients have less education than we do, right? Just even that difference alone is going to shape how you perceive things, and you're going to have a distorted view already just from our education and training level. So just because we're trained doesn't mean we are perfect observers of fact. So making sure that you stay curious, you stay open, you ask, you try to understand, because we all bring in our own biases as well. And there isn't a one size fits all family structure, couple structure, individual behaviors that makes, for mental health for everyone. Okay. Okay. So you can download the form at therapythatworksinstitute.com/books. So people are asking which models did I draw from? Pretty much every model in my family therapy textbook. So you will see elements, obviously, of Bowen. We have the genogram, psychodynamic, we have the attachment patterns. We have satir communication standards, as well as attachments also in EFT, interaction patterns, our systems, boundaries are structural, family life stages structural. You saw Gottman kicked in there. Obviously solution focused, obviously narrative. The interactional cycle it also relates to cognitive behavioral therapy. So this is cross-theoretical. So every major theory in my book has some element here in this cross-theoretical approach. So it is a cross-theoretical framework, and there's also one in the counseling and psychotherapy textbook, my theory and treatment planning and counseling and psychotherapy textbook also has a cross-theoretical one as well. So yes, but you can go here on this books page, you sign up to get the access to the free forms, because I have to keep it behind a wall for my publisher since it's all copyrighted. But you can download everything for all my books there. So that's really kind of nice. So have fun with that. Put it into a nice folder. Okay. Yes. So the form is totally available. It is on the therapythatworksinstitute.com/books. And if you sign up, and I'll let you know when I update it as well. So let me see if I got any more questions I can answer here. Yeah. Claire is just saying that, yeah, she found genograms to be very helpful for both her and her clients' understanding and many aha moments. I know. I don't know why I get such resistance from my students, but when they finally do it, they usually do really enjoy it. Okay, so and the collaborative therapy is actually in that getting everyone's description of the problem. Yeah, and so the collaborative therapy is built into this, and certainly my new unifying framework draws quite a bit on collaborative therapy, because that is certainly where I was trained in that in depth, and I've done my research in that. I've done research in that area. So yes, someone is saying that they've been intimidated by genograms. Oh, no, it's a tool for you and the client. It's best to do it with the client. They love it. Mine, if I do it in person, we do a little whiteboard. They usually take pictures of it, bring it home. So genograms are great for everyone involved. Yep. Okay. Yeah, so boundaries regarding infidelity. Obviously, infidelity is probably the most major boundary violation. Okay, very good, very good. Okay. Oh, so D is asking, do you ever find you change your hypothesis midway through? Actually, in classic systems, you change it every session. You should be refining it. Hopefully, each session you learn a little bit new information. In classic systemic family therapy, where this is a hypothesis concept was developed, they changed it in between every session, they refined it. And sometimes, yes, they totally changed it. And it's very important. There's this great video. I don't know if I can ever find it again, but I remember a Boscolo from the Milan team. They were at a conference. It's being recorded, and they're doing the pre-session, and they're throwing around their hypotheses. And he says, "Oh my God, we need to stop talking, because I'm beginning to believe my own hypothesis. And we're getting married with my hypothesis," is I think what he said. So the idea is a hypothesis should be fluid. You should not be overly attached to it. You should be ready to let go of it any second a client proves you wrong. It's just used to help you guide your intervention. Again, it's a conceptualization. It is not the truth. And also know that all of these conceptualizations come from our languaging, our theories. They are not the truth. They are a way of describing what we are seeing to try to help us be more helpful to our clients. They are not some absolute God-given truth or universal given truth, however you want to conceptualize it. They are just tools that we use to help us be helpful to others, and be careful. I always follow Boscolo's advice on that, is I never believe what I say too much, because that's dangerous as a clinician in terms of really being responsive to our clients and their needs. Oh, thank you, Sheila. She said, thank you so much. Best session she's attended on conceptualization thus far. Woohoo! So yes, thank you, thank you. Love it, love it. So, so Claire is asking, do I tend to utilize one or more models in practice depending on the clients? She's curious what aligns with me. I have come to use what I call the unifying framework, and I use them all. And I use a synthesized unifying framework. I teach the Therapy That Works unifying framework course because I think we need it all. The truth is I've been writing these textbooks for 30 years, and I noticed that I was using them. And I'm talking counseling theories as well as family systemic therapies, postmodern, psychodynamic, humanistic. You need them all. Like you need existential. So um, what I've done is, and I'm not the only one, there's this whole second wave of integration out there where unifying and synthesizing them all. The problem is with traditional integration, we were still piecemealing it together and it's overwhelming. And so I think we will be seeing my unifying framework is one. There are a couple others out there where we are going to be synthesizing so that you have a simpler framework to use, but it draws from all of these different approaches because we need them all. You need them all, especially with the way people with our clients are presenting much more serious issues than in the past. And so all I can say is that you do really need it all. Okay. When is my next webinar? So every month I have one of these webinars I use to I'm recording it. This will become a YouTube video. If you're watching the recording, this was once live, and I record all of my YouTube videos live once a month. And you can go to therapythatworksinstitute.com, YouTube live. And I believe it's what it is. So I'll go back and go find that one that gets you that link as well and put it in the chat. But or you can all just go to therapythatworksinstitute.com. And what you will find is that once a month you can sign up for a free training. There are no CEs. Oh, I almost forgot. So here's YouTube live, and this is where you can see the future. And then if you are a student who needs an attendance certificate, the word has gotten out that we give free attendance certificates. They're not CE certificates. CEs do actually cost a lot of money to give people. But we do give, see here, attendance certificates to graduate schools because some grad programs will let you, they will let you count this training. And if you get a letter from us, and we get so many requests now, we are only going to offer it through this link. So if you are a graduate student who wants credit for this, I'm sorry I can't give credit to this people on YouTube, but if you're watching live, if you need a letter, go to that, click on that link, and you will get a letter that you can give your university. Yeah, we just got inundated. Um, it's beginning, my assistant is now spending hours and hours doing these letters. I'm like, okay, this is getting very expensive. So there is a letter of attendance link. You'll see www.therapythatworksinstitute.com, and there is the last link I just put in there if you're attending live, not if you are attending watching via YouTube, but anyone who attended live can get a letter to give to their university with the link I just put in the chat. So that will give you a nice letter to automate. And so that way we can help as many students as humanly possible without overwhelming my staff. Okay, so yes. Yeah, so if you're a new student, if you're a student in a graduate program, a lot of students can get this letter and use it in their graduate program for their professional development hours that they might need. But if you're licensed and you need it for licensing board, you're going to have to show up to one of my formal free CE trainings. I give 2 or 3 a year now, at least. So just stay on the mailing list. I think I give more free CEs, I've been told, than anyone. And so, yeah. So yeah, so if you attended the structural one, I'm sorry. I don't, you're going to have to email, and I don't know if we have records that you attended. So for going forward, this is how we will be doing it, is that there will be a letter of attendance. You can go to this site to get your letter of attendance at the end of these workshops. So hopefully you get it. Okay. Yeah. Sorry about that. So yeah, so I do this just to get to give a free training because it's more fun to do it live than usually for many of us. At least it's more fun for me to record live than it is for me to do this in a lonely room by myself. I get the questions, which I think make it a better quality workshop. And so I can clarify things that you can't do when it's not in live real time. But hopefully this gives you a good sense of what to do. If you have to do this assignment this semester, I apologize for it will probably take you 10 hours to finish the assignment, but it is well worth it. And it really does help prepare you for licensure. If you're studying for licensure, this is a great exercise, not to do a month or two before your licensing exam, although it's good if you've got clients, you put them through at least in your head. But it's a great exercise. I know you will complain halfway through it. I complain halfway through grading them. So, but that said, it really helps you see how all the theories intersect. And you can see where and how I eventually developed my unifying framework by putting so many clients through these lenses, you begin to see the intersection points. And so it really is a great way to get good at doing this work. Okay, so hopefully I'll put it one last time, the link to get to get a letter of attendance for this workshop. And otherwise, I wish you all the best and enjoy filling out this worksheet. You can use it on yourself and your friends and family too. Thank you so much. Thank you, everyone, for the kind words. You know, if you attended the structural family therapy one, we'll do one last time. You can email friendlyhelp@dianegehart.com or go to the contact page on my webpage and ask. We'll do one more round of this because we got hundreds of requests. So this way we actually get to do this without it overwhelming our staff. So thank you, everyone. Wow, I'm glad people really like this. I thought I would have overwhelmed you all, but it seems like people are happy. Awesome, awesome, awesome. Thank you all. Be well. Take care. And yeah, so I wish you all the best. You can email, you go to there's a contact page at friendlyhelp.com. No, at therapythatworksinstitute.com, and I will put the email for the support for my institute here. It's friendlyhelp@dianegehart.com. So yeah, very, very good. Yay. Nancy likes talking about all the theorists. I do too. I'm a theory nerd. What can I say? That's why I write textbooks. That's that's what happens. It's fun. It's good stuff. It's always something to think about and explore. Okay, everyone. Hopefully you got your letter of attendance in your hot hands. Woohoo! And immediately, so nothing like instant gratification in the 21st century. And I wish you all the best, and hopefully you got some good insights for working with your clients. Be well and take care. Thank you, everyone, for showing up. Take care. Bye-bye.